After eliciting the history, we will review systems. Before that, please subscribe to the channel. Systems review at neonate, at the toddler and child. First, the general condition at the neonate: check the weight gain, appetite, sleep. At the toddler, check the weight gain, appetite, sleep, milestones. Is the child its normal self? At the older child, we will check if do they feel unwell, tired, or fatigued. And how is school? After, we check the cardiorespiratory system. At neonate, if there any tachypnea, grunting, wheeze, cyanosis, cold sweats, heart failure, exposure to TB, smokers in the family. Is there a family history of a heart murmur? At the toddler, if there any cough, exertional dyspnea, sputum, hemoptysis, exposure to TB, smokers in the family. Family history of a heart murmur or rheumatic fever. At the older child, if there is an exercise limitation, cough, wheeze, sputum, hemoptysis, chest pain, exposure to TB, smokers in the family. Family history of a heart murmur or rheumatic fever. We will check the gastrointestinal system. At the neonate, check the appetite. Diarrhea and vomiting, feeding problems, jaundice, bleeding, appropriate weight gain. At the toddler, check also the appetite, diarrhea and vomiting, stool frequency, rectal bleeding, and weight gain. At the older child, check the appetite, diarrhea and vomiting, abdominal pain, stool frequency, rectal bleeding, weight loss. Urinary system. At neonate, wet nappies, how often? At the toddler, wet nappies, how often? Is there a history of infection? Any hematuria? At the older child, check hematuria, dysuria, discharge, sexual development. History of infection. Any history of bedwetting, menarche, polydipsia, polyuria. Muscular system. At neonate, seizures, attacks, jitters. At toddler, seizures, drowsy, hyperactive, low hearing and low vision. Gait. At the older child. If there any headaches, fits, odd sensations, drowsy, schooling, vision, hearing, coordination, ear, nose, and teeth system. At neonate, noisy breathing. Did the baby have a newborn hearing test? At the toddler, are there problems with hearing or balance? Problems with ear infections or discharge? Any difficulty breathing, nasal discharge, snoring, or bleeding? Any lumps or glands? At the older child, earache, discharge, recurrent infections, problems with hearing or balance, difficulty breathing, nasal discharge, snoring, or bleeding, lumps or glands, sore throat, dental problems, or mouth ulcers. System. At neonate, is there a rash, birthmarks or other marks on the skin? At the toddler, is there a rash? Is it itchy? Birthmarks or other marks on the skin? At the older child, is there a rash? Is it itchy? Birthmarks or other marks on the skin? If you have any questions, thank you for your attention. If you like this video, please share and subscribe.